This is a One Woman TV, a platform to live lives. So this afternoon we have a veteran and seen it all when it comes to nursing profession. So it's a wonderful opportunity for her to have let me into her wonderful home today to also bring out the wealth of knowledge this woman has in her in order to empower our generation. So if you are watching me there, please do me a favor, share this live stream, get other people to come and watch this amazing woman. So without wasting much of your time, my name is Christy Amalo and I am the host for A Well Woman TV. And I have with me today a veteran, Martha George. God bless you, Mom.
Thank you. Thank you.
You're welcome, Ma.
It's
Thank
good
you
that we
so
have met.
Yes.
And thank you for asking me to join you on your platform.
Thank you so
Thanks.
much. Thank you so much. So this is an amazing opportunity, like I said. It's always good when you encounter something important, something so special. You don't keep it to yourself, you bring it out. And it's not just only for ourselves, but for people out there and for generations to come. So we are grateful for being here. So, having said that, Mom, if you don't mind, can you just introduce yourself to our viewers?
Hello, everyone. I am Martha George, and I'm a retired nurse. I have been a qualified registered nurse, midwife, done some theater work, gynecology, obstetrics, and I specialized as a radiology nurse, specialized in diagnostic and investigative procedures.
Fantastic.
Yes.
Wow. Wow. So, this is when you talk about nursing, she's an all rounder. Yeah. She has done the general nursing, the midwifery. She's a radiologist nurse and, and diagnostic as well. So she has actually, acquired so much experience. So if I were you out there and you have someone that is in nursing already, or maybe aspiring to go into nursing, please, this is an opportunity to pull them closer, okay, to this wonderful interview. So once again, I thank you so much, ma'am, for being here.
Thank
Okay,
you for asking me.
you're
Yes.
welcome. Yeah. So what I just want to ask is, what first drew you to nursing?
Well, when I was growing up as a child, my mother was a very caring person. And
Please speak up a
always,
little bit for me.
yes, always cared about the unfortunate and people in need. And growing up, when my mother fell ill and died, leaving me as a young child, when I left school, I decided I want to go into the caring profession. At first, I thought going to teaching, but I thought in nursing you can also teach. So you have two professions in one.
Wow.
Teaching and caring.
Wow. Wow. So meaning that, from the caring aspect of your mom's character,
Yes.
that's inspired you to go into nursing.
Yes.
Wow. So
Yes.
does it mean that mothers have roles to play?
Oh, yes.
When we are nurturing our younger ones?
Very much so. Very much so. Yes.
Wow.
Yes.
Wow. And also, like they said, do as I do, not as I say. So you were actually watching your mom, you watched her caring aspect, and then that, you know, inspired you to become a nurse.
Yes. And sometimes, people people say, do as I do, not as I say.
Mm.
It doesn't always apply
Mm.
because you have to say what is right.
Mm. Mm.
So they can do as you say
Mm.
and
Okay.
also do as they do.
Fantastic. Okay.
Mm.
So, but was there a turning point, yeah, that reaffirmed your passion for nursing?
There was no turning point when I've measured between going to teaching and going into nursing. My mind was focused on caring for someone who's unable to care for themselves,
Mm.
caring for the vulnerable. Now, with the medical profession, whether it be nursing or any part of the medical profession, my belief is that the wealth of a country is dependent on the health of the nation.
Absolutely.
If you do not have a healthy nation,
Mm.
your country will fall.
Absolutely.
You need healthy people
Mm.
for a healthy nation
Absolutely.
and a healthy country.
Mm. Mm.
It's no good trying to run a country
Mm.
when everyone is ill.
Mm.
So it is that motto
Mm.
that I believe
Mm.
that it is the health of the nation that is the wealth of your country.
Absolutely. Mm.
Mm.
Thank you so much. It is the health of a nation that is the wealth of that nation. So,
Mhm.
our leaders, can you hear that? Okay. So, just asking as well. Yeah. Can you share a memorable patient or moment from your career that has stayed with you?
Yes, there are many, but there's one in particular I would like to share. I would like to share a more. Sometimes someone can be brushed aside. It is important that you listen when you have. And I recall this young lady. I was working in the ultrasound department. And when I walked out of the room, I saw this lady stamping. I said to her, "What's the matter, dear?" And she said, "Oh, there's something in my hand every time." I said, "Well, what were you doing before that?" And then I don't know what it is, but something is in my hand. So she's gone to A&E and they've referred her to the rheumatology department. They've said, oh, it might be rheumatism. So she's gone to make an appointment to see the rheumatologist.
Mm.
So I said to her, just wait a minute.
Mm.
Mm. And I went to have a talk with the sonologist who was at,
Mm.
and she's a rheumatologist,
Mm.
but she don't think it is rheumatism. Time it's not like today where you need to have specific things.
Mm.
We will care to see what it was she was, and we found there was a sewing needle
Mm.
in her hand.
Can you imagine?
Yes.
Hmm. And she was waiting for a rheumatologist,
Yes.
whereas there's an object.
And yes.
Mm.
Mm. So we were able to refer her
Mm.
to the surgeons
Fantastic.
to have this foreign body out of her hand.
Mm.
And I'm sure this woman was just
Oh,
more than grateful
she should.
rather than waiting. Wrong diagnosis.
Yes.
Mm.
Mm.
Yeah.
Thank you so much. Thank you. So that shows that, You
It is
were,
important to see the patient
that's it.
and listen.
Yeah. Listen and observe.
Yes.
Yeah. So making use of your five senses.
Yeah.
Yeah. Your sight, your tactile, everything within you to put into care.
Yeah.
That's when you make a difference. So a lady came in having to wait for a long time, yeah, to see a rheumatologist, only to see that she has like a splint, foreign body, yeah,
Yes, and the sewing
a
needles. The
sewing
sewing
needle,
needles travels.
yeah,
Yeah.
it travels, it could cause more problem, you
Yes.
see. So thank you so much for doing that for us, and
Yeah.
also for remembering that. And I know
Yes,
there are so many
because I could have
experiences.
ignored her
Yeah,
because she's throwing a tantrum.
yeah.
But then I wanted to know why she's throwing a
The
tantrum. And that is caring.
That's caring. So sometimes when you see people behaving abnormally or maybe being agitated, don't just judge them and say, they should get on with it. Or because of their behavior, you turn,
You turn a blind
a
eye.
blind eye
No.
towards it. Just to go closer, find out, what is the problem and see how you can rectify that for them.
Yes.
Okay. So now, going forward again, how has nursing changed since you started?
Nursing has changed enormously. When I started, we started not as a job, we started as a profession, a caring profession.
Absolutely.
Yes. Because in the profession, there are two things. There's treatment and there is care. Treatment and care are two different things. And why are they different? A patient may demand treatment they don't need. A professional person may give treatment the patient don't need. But whether the patient wants treatment or not, you are under a legal obligation to care. So caring is important and it comes under judicial law. So you are legally obligated to care, while you are not legally obligated to treat, because your hospital may not have the facility to treat that person. But that facility has the obligation to refer you to facility to care for you, because that is what you take on. At the end of your training, you take an oath to care. You don't take an oath to treat, but you always take an oath to care, and you are bound by it.
Wow. So to any nurse out there or any caregiver, watching us, so you are legally obligated to care. No wonder we have this adage. Some hospitals, especially where I trained, yeah, we had it that, God, we care, but God heals. So we are obligated to give that care. So if you have taken a nursing job or a nursing role or a caregiver role, healthcare assistant in any shape or form, just know that legally you are required to give that care. So, it's something that has to be done. For treatment, treatment might not be, it's not legally binding from what I'm learning today. So I'm learning as much as I'm trying to relate this to you. So thank you so much, ma'am, for giving us that heads up around care. Okay, so you can be pulled up for something for neglect.
Yes, yes. Not listening to a patient is neglect, and it comes under medical negligence.
And a lot of hospitals get sued, because of that.
Yes, not listening.
Yeah.
If you don't listen, you cannot care.
Good. Thank you so much. And also, going forward as well, you said you've told us how nursing has changed. That's fantastic. And so, what practical advice will you offer to aspiring nurses or caregivers today, based on your experience?
Practical advice I would give when you are choosing that particular profession, one, it is a profession that binds you legally. It's a dedication to care for a particular person. That person's life is in your hand. It's not an easy, it is not a profession that's glamorous because you have to deal with feces and vomit and everything else. It is something that you must want to do and want to dedicate your life to do. If there's no dedication, there's no point going into that field unless you have it within you to care. And my stress is always on care.
Yes. And it surprises me when I see some caregivers malhandling patients,
Mm-hmm.
not treating them with respect,
Mm-hmm.
looking
Yeah.
down on them.
Mm-hmm. Mm-hmm.
Nursing or caregiving should be a calling.
Yes.
It should be a
Mm-hmm.
calling, you know. But it's so many people now have turned it to, you know, a means of livelihood,
Yes.
working to get money and all that. But
Mm-hmm.
I could remember when I went into nursing, we weren't even talking about money.
Yes. Yes.
That passion, when you see someone that is struggling, you go closer, hear them out, be heard, you know, you have to deal with a lot of dirty stuff.
Yes.
Yes. When they are vomiting, you're there for them. They are opening their bowels, you're there for them. Even it's in nursing that you even understand, the importance of somebody waking up in the morning,
Mm-hmm.
can go in, brush their teeth nicely,
Yes.
pass water when they need to, and open their
Mm-hmm.
bowels.
Mm-hmm.
Because you would tend to realize that any form of impaction or anything, is quite detrimental to health.
Mm-hmm.
So those areas, are things we ought to embrace.
Yes.
So nothing is not about looking psychedelic or about the
Mm-hmm.
money that is coming, but it's about looking after people with utmost care.
Yes. Mm-hmm. Which is why you need a license to practice nursing.
Hmm.
And that license need to be renewed every year.
Hmm.
And it is
Absolutely.
for the betterment of the patient because of your responsibility.
Hmm.
It's just like having a car, you need a license to drive it. Yeah.
Yeah.
And people's health and life
Hmm.
are important. And
Hmm.
you have taken on that role to be responsible for that person's life, that person's care. You can ruin a person's life by a simple mistake and you don't recognize it, and that patient has brought that to your attention. Pay
Hmm.
attention and try to rectify that mistake. Don't try to hide it.
Hmm.
It's best to
Hmm.
rectify, apologize to the patient and said, I'm sorry this has happened, but this is what we are going to do about. Yes. Don't leave the patient to their own devices. Too many people are maimed
Hmm.
because professionals do not listen. There's the difference between between hearing and listening.
That's it.
When you listen, you take action. When you just hear and
You see that we know the medication,
yeah,
times, the appropriate time,
yes,
is part of
after a meal
yes.
and some before a meal. So if you give the wrong times, then you affect that patient's. Yeah.
Wow, thank you so much. And also, I know you've said it again, but I just want to ask as well that if you could give one piece of wisdom to next generation of healthcare workers, what would that be?
My advice would be come into it with an open heart. Come into it with love. Come into it with passion. Don't come into it just to say, well, I'm only doing it for me to travel. Because I've heard some people say, well, I'm only doing it because I want to travel. So you can work at agencies, different places and get. This is not what the caring profession is about. I remember when I started, it was nearly 3 years before I got a penny. When I started being paid, I was getting £55 a month. Yes, compared to now. Yes. So my advice is that choose carefully. You do your generalness and then you decide what you want to specialize in. Yeah.
Absolutely. Thank you so much. Yes, and also, when you reflect on your career, what do you hope your legacy as a nurse would be? And what would you want viewers to remember most?
Well, I would hope that, and a legacy would be one who cares. I recall some time ago I met a lady on the bus and she said, nurse. I looked at and I couldn't remember her. And she said,
Fantastic. Yeah.
So my legacy is that I was strict, but I was good.
Yes.
Yeah. I said, yes, I have to be strict because I'm responsible for you being alive whilst I'm caring for you.
Absolutely.
Yeah.
Absolutely. So that legacy is one who cares.
Yes.
Okay.
Yes. Remember,
Yes.
you are responsible for that person's life. As a midwife, you are responsible for that person's life until that person is 21.
That's it.
A lot of midwives may not know that.
Yeah.
But as a midwife, you are responsible.
Absolutely.
Yes.
Absolutely. Yeah.
Yeah.
So we are responsible. If you're a nurse there, you're a caregiver, just have care as your core.
Yeah.
All right. Have it as your core. Please think less about, the frivolities around it, the high wages and all that. So if you could listen to ma'am, she did mention that for the first 3 years of her career in nursing, she wasn't even paid. Yeah. And when she actually got paid, it was about £55. Just to tell you how far, she's been in this job and how long she has come. And for her to have, gone through it all these years and she's still standing is because she really cared.
Yeah.
Because when we come to biblical terms as well, when you do good, God would always visit you with good.
Yeah.
The good you tend to other people will come back to you.
Yeah.
He said, he that watereth shall be watered. So no wonder she has done her career nicely and she's enjoying her retirement. Sound, you know. If you don't mind me asking, I know this one is private, but can you tell us how old you are?
Oh, I'm 82.
Stay tuned.
Yes.
Okay,
Thank
so
you
we
so
are
much.
okay again. So
Yeah.
now we are ending the session for today. We just want to say big thank you to our wonderful guest, a veteran, who has devoted all her life nursing, looking after people, and not just giving that care to people. So one thing we have learned today is a piece of advice that she has given us is, as a nurse or as a caregiver, just be that one person who cares. Always listen to your patients. Yes, you can hear them, but listening is better, because when you listen carefully, you'll be able to know what actually is going on in their lives, and you'll be able to tender that care. So we'll come back to you again, because this amazing lady, she has a wealth of knowledge to give us. So, Mom Martha, thank you
Yes,
so
thank
much
you
for
so
having
much, and
me.
thanks everyone for
Thank you.
listening.
Yeah.
Yeah,
So
yeah.
I make sure every opportunity I have, I don't waste it. I just came in to visit her, and I said, no, all the wisdom she's been passing on to me, I'm not going to keep them alone. So I hope it goes out there to inspire anyone. So please do us well by watching, sharing, commenting, and telling us what again you want to see on our live stream. And we'll come back to you soon. Okay. So, on behalf of a Well Woman TV, I just want to say a big thank you for watching us. God
Thank
bless
you,
you.
everyone.
Yeah. Until next time, we say bye bye.
Bye.